What is LKBridge? To understand LKBridge completely, it would be best to peek inside a clinic's workflow and see exactly how it works. This is Bob. He needs to visit his doctor today for his yearly checkup. Let's follow Bob on his visit. At the front desk, Bob shows that he has new insurance and hands the card to the staff. The staff verifies his record and adds his insurance information into the PM system, makes a copy of his insurance card, and adds it to the patient chart. The physician now examines Bob. Asks the nurse to order a blood test and takes a sample. The assisting nurse will fill out the requisition, starting with patient information, insurance information, and test and specimen details, copying all the information manually. Now let's compare the workflow if the clinic was using LKBridge. Instead of handwriting all the patient details manually from the patient chart, the nurse will simply select the Bridge button, look up the patient using Smart Search, and with one click, all the patient demographic and insurance information is seamlessly bridged over to the laboratory ordering system in less than 3 seconds. The nurse selects the test and hits enter to complete the order. With LKBridge, practices never have to retype patient demographic and insurance information that already exists in their PM system, saving them time, reducing inaccuracies, and providing a better user experience. Bob is done for now. The clinic will follow up with him once the results are back. Now we go to the laboratory and see how they process Bob's order. The lab receives Bob's specimen, along with the requisition. The sample is processed, and the claim gets submitted to the insurance company. But this is where it gets complicated. Claims that are submitted using requisitions that are manually filled out are not always clean. They could be inaccurate or have missing information. And that's what happens in Bob's case. The claim gets submitted to the insurance company and is rejected on the first attempt. The lab staff goes around in circles, on one hand trying to communicate with the busy clinic to verify the insurance information, and on the other hand calling the insurance company to find out the reason for the rejection. Not knowing the cause of the rejection, the billing department sends Bob the invoice, hoping for him to pay. Bob is now confused and furious as to why he has to pay the laboratory bill when it should be covered by the insurance company. After going back and forth a few times, eventually the lab staff finds out that the assisting nurse used the old insurance information from the chart. The clinic office staff relays the correct data over the phone to the laboratory billing company, who then resubmits the claim to the correct insurance company and hopes the new claim will go through. Illegible data and incomplete orders lead to loss in revenue for the lab. When a laboratory receives orders that are created using LKBridge, the data is more accurate as it is taken directly from the PM system. Accurate data in laboratory orders reduces billing errors and ensures that claims submitted to insurance companies get processed immediately. Not only does this reduce claims processing time, but this also leads to faster payments. For more than 10 years, LKBridge has provided vendor-agnostic connectivity to 450 different systems across 900 different versions of these systems. LKBridge saves time, reduces inaccuracies, and produces clean orders for laboratories, while practices benefit by changing their focus to providing better patient care. For more information or to schedule a demo, contact LKAY at 201-791-0606 or visit our website at www.LKAY.com.